Innocent heart murmurs. Heart sounds are noises that are generated by the heart, as the heart valves open and shut during different parts of the heartbeat. The noise is best heard with a stethoscope. Now, in healthy individuals, there are two normal heart sounds. These are often described as a lub and a dub, and these occur in sequence with each heartbeat. Murmurs are generated by the turbulent flow of blood and may be physiological or innocent, or pathological, which means they're abnormal and probably due to a structural problem.
Innocent heart murmurs. Innocent or functional murmurs are very common in babies and children and are not due to congenital heart disease. These murmurs are usually generated as a consequence of blood flowing at speed around tight corners and bends in a relatively small heart, as compared to an adult. Innocent murmurs become more apparent during times when the heart is working a little bit harder, producing more turbulence, such as during a fever or exertion, or if the child is anxious or upset.